Thank you for beginning treatment with us and trusting us to give you the best smile possible. The journey to a great smile is very rewarding, and I'm going to give you some ways to make it successful and allow you to finish on time. Clean, healthy teeth make the best smile. Continue to see your family dentist for regular exams and cleanings. Do your best to keep your scheduled orthodontic appointments. Missed or last-minute changes will typically lengthen treatment time. Follow the directions given by us to your best ability. Great cooperation leads to great smiles. Never leave the office if you have a question or concern. We are now part of the same team, and we want to help you every step of the way. We have one pretty amazing location, so you'll always know where we'll be. And we'll work together for any treatment decisions. Be sure to download the My Orthodontic app on your smartphone so we can send you cool information that you can reference as needed. You can schedule appointments and send us messages directly through the app. You know, our mission is, we want to improve the world we live in, one smile at a time. Well, let's get started. Your treatment will include a combination of aligners and appliances. There are some simple things you can do to keep treatment on track and prevent problems. It involves how you eat and brush with your new appliances. We often begin a combo treatment with a motion appliance.
Hi, I'm Juliana Kadar, Dr. Kadar's daughter. My dad asked me to talk to you about what treatment you may need before braces or aligners. They're called motion appliances. These motion appliances were created to help fit your teeth in a better position before you get your braces or start wearing aligners. They fix the toughest part of getting teeth in line first, so that when it's time for your braces or aligners, you can get finished faster. Actually, a minimum of 6 months faster. And isn't that what everyone wants?
When your bite correction starts with a motion appliance, there are a few components that you'll hear being talked about. So let's look at them now. First is the motion appliance. That's this Carrier Motion 3D part. It just attaches to your teeth. Like everything here, it's a painless procedure. We just place them on your teeth with a unique adhesive, then you're ready to go. After a few days, they're comfortable, and most patients don't even notice them. The motion appliance consists of two simple parts, the power arm and the button or sidekick. A button is placed on your teeth. Again, it's tiny, painless, and what it does is allow you to attach the elastic to the correct tooth. You also hear about elastics. They're special rubber bands that make the motion appliance work. They kind of act like the gas pedal on your car. While you wear them, you're going full speed. If you don't wear them, the teeth will not move and your treatment is at a standstill. When they're in, they look like this. There are different sizes that we choose for you, and what they do is to help move your teeth and their bite in the right direction. It's important that you follow direction and wear them as we ask. When you're home, you have to change them at least 3 or 4 times a day to get the best results. It's easy to remember because you have to take them out when you eat and brush your teeth. Here's a simple demonstration of how to place the elastic for the motion appliance. Always start in the back. The molar hook should be placed first. Once that's on, then you can bring it forward to the power arm, let go. If it stays on, you've got it. The final word you might hear is retainer. With all motion appliances, all patients wear a retainer to prevent unwanted changes. A retainer is a custom-made piece that fits in your mouth. It looks like this. And goes in like this. It's extremely important that it's worn all the time when you're wearing your elastics. It's extremely important that it's worn all the time when you're wearing your elastics. That's because the motion appliance, elastics, and retainer all work together to get the job done.
On the day your motion appliance is in place, you will only experience minor discomfort. I mean, you have new stuff in your mouth, right? It's okay for your parents to give you an NSAID medication like aspirin, Advil, or Motrin. They will help relieve any soreness you may have. As the motion appliance does its thing, you may notice spacing of your teeth or little gaps, which is normal, and they will be addressed later when you get braces or aligners. You will begin the motion elastics a few days after the appliance is placed. You can expect to feel soreness, but continue to wear the elastics and retainer and it will go away in a day or two. The retainer will be worn whenever the elastics are in. The retainer needs some basic care as outlined here.
Don't forget, it's really important to keep the aligners and retainers clean. I like liquid or soft soap, and I'll use my regular toothbrush and run it on the inside and outside of the aligners to make sure they stay sparkling clean and they smell great.
See, the Motion appliance is easy to wear and maintain. If you follow the tips we outlined, you should be finished the Motion part of treatment in 3 to 6 months. Hi, I'm Juliana Kadar, and I want to share some info about virtual appointments with you. Actually, check this out. It's my orthodontist. Okay, it's my dad, but he's my orthodontist and he's yours too. And you can do your ortho visits virtually. It's super easy, saves you and your parents a ton of time, and if you're not experiencing any problems with your treatment, they are the perfect way to go. We have it all set up on our website. Just go to gokadar.com. Now that you're a patient, click on the blue button and sign in. That's it. We also added this yellow bar, and it explains exactly how to take the pictures that you need for great pictures for your virtual visit. I would say click that first so you do it right the first time. The photos are easiest to take with a cheek retractor, and if you need one, we can provide it for you. Of course, you will need a traditional in-office visit, but for some of them, give virtual visits a try. They're easy. It's the absolutely safest way to have a visit and saves you time. All good stuff.
See you soon, on your phone or in person.
Good stuff. Well, that was an overview about the office, and now for some info about your specific treatment. Hi, Juliana Kadar here. We're seeing a lot of each other at this point, aren't we? Well, just being honest here, this is my absolute favorite topic, food. When you first get your appliance or braces for the first 3 days, you'll want to eat only foods with a mashed potato consistency. So food that doesn't require a lot of chewing, like soups, mashed potatoes, smoothies, milkshakes, and Jell-O. During the whole time you're wearing any appliance or braces, cut up apples, cut corn off the cob, and cut meat off the bone. A good rule is if you cannot break or cut it into smaller pieces, you shouldn't eat it. There are some types of foods you need to avoid the whole time that you have your braces on. Basically any food that's hard, like pizza crust, nuts, hard candy, or ice cubes. And everything sticky or chewy like gum, taffy, or candy. Braces and appliances are meant to come off someday, so these foods could break them. It's easy to remember. If it's hard, sticky, or sweet, it's bad for your teeth. That's super important, so let my dad tell you.
Remember, if it's hard, sticky, or sweet, it's bad for your teeth. Hey, how you doing today? You may not know that soda and fruit juices are considered sweets because they have high sugar content. Stick with water as a drink to sip all day, every day.
Other things can damage your teeth and braces too. Avoid biting or chewing on foreign objects like fingernails, pens, pencils, or mouth guards. You also need to avoid pushing on or playing with your braces and wires. This can damage or distort them, which may extend your treatment time, and nobody wants that. That's it for food. Remember, if it's hard, sticky, or sweet, it's bad for your teeth.
And cut!
Ugh, all this talk about food's making me hungry. I need a snack. Hey, Juliana here. Yup, me again. Time to talk about hygiene. So here's the deal. No sugarcoating it. If you don't take care of your teeth when you have braces or appliances, your teeth will be stained and ugly when you're done treatment. You notice I'm not saying your teeth may be stained. I'm saying they will be stained. So you've got to do this right every day. It's just part of the deal. Since my dad's a doctor, I'll let him tell you so it's more official. Take it away, Dad.
Thanks, Juliana. When you're in treatment with a Motion appliance, braces, aligners, or retainers, you've got to follow these rules. Number 1, continue to see your general dentist at least every 6 months during treatment. Number 2, brush after every meal if available. And number 3, floss at least 1 time a day. When brushing, focus on 3 things: brackets, teeth, and gums. Hold the brush at least at a 45-degree angle and brush in small circles to ensure all surfaces of the teeth, braces, and gum line are clean. A lot of patients have questions about how to brush and floss. We'll go over that with you, and if you have questions, just ask or visit our website. There's content about it there too. Your family dentist and hygienist are terrific resources too. Some additional tools that will give you a better end result are electric toothbrush. Rotary brushes like Oral-B are excellent tools to increase efficiency. A water pick will really help and are available at any drugstore. Proxy brushes, the little Christmas tree brush, will help you clean between the wires to ensure you've done it right. The brace flosser, which is a one-handed flosser, it can be used under the wire. And fluoride. Each day, you can use a quarter cap of the rinse by swishing it around in your mouth for 1 minute and discard. You should not eat or drink for a half an hour after using the rinse. Before bed is a great time to use the fluoride rinse. Whitening toothpaste can still be used with your appliances, and any possible shade differences that may occur will quickly return to normal after treatment is complete.
Taking care of your teeth is serious stuff. You've just got to do it. There's one more thing that I know you don't want to hear. It's just so important. You have to minimize sugary liquids in foods. When I say minimize, I mean like make a choice not to have them. Like barely any, if any at all. I know I said earlier you just have to do this stuff. I want to show you what will happen if you don't. Check out these teeth. They are straight and beautifully aligned, but look at those stains. Ugh, not good. In most cases, you can have most of that fixed, but it's like a whole series of other treatments and whitening and a lot more work and even more expense. If you just do things right from the beginning, every day, you should be fine. So brush and floss every day and see your dentist every 6 months. Use the additional tools all the time as directed. It's important stuff. I know you can do it. If you have any questions or concerns, just ask or visit the care section on the website for more information. See you soon!
Starting orthodontic treatment is an exciting time. Remember, we're with you all the way to make sure the process is fast, easy, and fun. And to help keep your treatment on track and prevent problems, remember the 4 important KDAR family rules. Number 1, keep your teeth clean. Number 2, stay comfortable. Use Tylenol or Motrin if needed. Number 3, feed the belly. Don't stop eating. Number 4, stay busy. Keep active. It keeps the mind from thinking about the appliance.
Well, there you have it. You've begun orthodontic treatment. I bet you feel like an expert by now. If you have any questions or concerns, just ask. I bet my dad or anyone on Team KDAR will know the answer. Or visit gokdar.com for more information. See you soon!